Cinder was a mare who came in to Horse Plus in pretty rough shape. We estimated her to be about 20 years old. And on her intake, she showed a lot of behaviors that indicated a traumatic past. We don't know what her past was, but she was very reactive to humans.
So this horse is exhibiting some behavior issues. It's acting like it's trying to protect itself. I would like to give it an opportunity just to kind of decompress here, and the next time that we pull it in, we're going to reevaluate its behavior to see how it's acting and if it's had a chance to kind of calm down. It was acting kind of weird towards me when I first walked in with it out in the back pen, and then it settled down and let me get the halter on it. So I think that it has an opportunity to change its behavior and that we could actually do something with it in the training program.
Right away, even on the first day, Corey and I both said, we really want to give this horse a chance because she was very interactive with us and she recognized that we were trying to help, and she allowed us to help her, but her body condition score was very, very low. She had very poor muscle tone. She was really dehydrated when she came in, but she responded well initially. She is the horse who was cast up in one of our quarantine pastures. There's an area inside where they have a round bale feeder, and she either slipped and fell or chose to lie down and got herself wedged between the feeder and the wall.
We saw her this morning, so we know that it wasn't a super long time, but it's, lunchtime. We're not sure exactly how much time. It's evidence that she's struggled a bit to try to get up, but because of the way she was wedged, she wasn't able to get up. Her mucous membrane color is pretty good, but her capillary refill time is delayed, so she's a little bit dehydrated. We've given her some pain medication, just a teeny tiny bit of a sedative to help her muscles relax while she's down, and we're going to give some warm rectal fluids with electrolytes, and then we'll see if she's able to stand. So we were able to successfully get Cinder back on her feet. Based on her external injuries and the appearance of the site, it looks like she may have been down for 2 up to 3 hours. She has some superficial abrasions everywhere. She's lame on her right hind, but she has a really significant superficial contusion of her head. We're gonna go run some blood work and take a look at overall function. She's had pain medications, anti-inflammatories. She'll be started on antibiotics. And then she's had fluid therapy and electrolytes, and she's out walking around and drinking. So we're not out of the woods. We're going to be watching her really closely, but right now I'm happy with how she looks.
We were able to sedate her a little bit and give her some medications and some fluids and roll her over, and she was able to stand up. And after that incident, she actually changed her personality a good bit. She became very friendly with me specifically, and I think with others on staff too. She would come up when I called her, and she would eat out of my hand, which wasn't initially the case. So I think the spot that she hit primarily is right here.
Yeah, that's what I was
The only concern that I had with putting it there was I don't want it to melt and go down into her eye. So I'll use your judgment, but it is improving. Easy, don't be grumpy with Dr. Gina. Good girl. Dr. Gina just put some topical anti-inflammatory, and we just wanted to get a really close look at it. All of these little areas where she lost skin are healing. She's already got hair growing back. And she really likes cookies. I think my pocket is empty. I ran out of them. Good girl. All right. Oh, yes. We're gonna float your teeth when your head feels better, so just prepare yourself for that, man. So she improved from that, but she just continued to struggle, and her radiographs didn't show anything significant, and her teeth were fine, and we just kept feeling like there was something that we were missing with Cinder. So we have Cinder here. Cinder was under training evaluation with Corey today. She's been really great. She was picking up all her feet, and she's having some difficulty with her right hind leg. So we are going to sedate her a little bit so we can get radiographs of that leg and also evaluate her teeth. And if she's got dental pathology, we'll be floating her teeth today as well. Oh goodness, are you okay?
Yeah.
Did she get you?
No.
Oh.
Not me, but I'm fine.
Kimberly.
She didn't get me.
All right, trade with me. Trade, we're trading off.
Who? What?
We're trading off. I don't want anybody to get kicked. Are you sure you're okay?
I'm fine. She got me, but it was right in the middle of my leg.
All right. Here.
And she would it was a very weak kick because she's sleepy.
Okay,
I'm glad
but
she was sleepy, though.
still not great. Corey, how would you feel about holding this front leg up for us?
Yeah, you bet.
Okay. Please do not get kicked. Yep, stop. Got it. So like that's an arthritic change right there. See how similar that looks to this?
Yeah.
So it's a lot harder diagnostically to tell. And like this, you could look at it and be like, that looks like a bony change, but because it's really consistent with all of this mud, it's probably just mud.
Okay.
All right, let's do her teeth. Oh, her teeth look perfect. Look at this, Dr. Gina.
Oh, yeah.
Like absolutely nothing. We just finished doing some diagnostics on Cinder. Her right stifle is swollen. Her radiograph didn't show any fractures, so we think that injury is soft tissue. She did kick Kimberly while she was doing it, so that was not great. Kimberly is okay, she has ice on her leg. Her teeth were perfect. We put the speculum on and we looked at all of the arcades. There was nothing that needed to be done, but she is a very, very poor body condition. So we went ahead and ran a CBC chemistry that is running right now. We don't have the results just to make sure that we don't have something systemic going on that we're missing. There wasn't anything we could really put our finger on as to what was going on. So our team did some more advanced blood work. And what we found out was that she had non-regenerative anemia. So anemia is just not enough circulating red blood cells, to simplify. And so that can cause all kinds of problems with your body being oxygenated and functioning. There's two main types of anemia. To oversimplify, there's regenerative and non-regenerative. And so regenerative anemia means your body doesn't have enough red cells, but it's actively working to make more and fix the problem. And then with non-regenerative anemia, you don't have enough and your body isn't working to solve that problem. It's not making new red cells. So Cinder's anemia was non-regenerative. And then unfortunately, on top of that, she also had several severely elevated liver values. So she showed evidence of a severe hepatocellular injury of some sort. One of the other differentials was neoplasia, which is cancer. So we looked at that blood work and we went, this mare is constantly telling us that she's painful and uncomfortable. And we kind of thought that it was somewhere in her hind end caudal abdomen area, but it wasn't until we ran that blood work that we had those answers. And unfortunately, the prognosis for both liver failure and non-regenerative anemia in horses is very grave to poor. So we often get cases where externally an animal looks like there's still a chance, and I often hear people say there was still hope in their eyes, and anybody who's worked in animal rescue will know that in our hearts we always want to save every single animal. I want to save every animal that I look at. My job as a clinician is to look at the facts and the data that I have and make the best decision for that animal with my emotions aside. And in these cases, we know from humans that go through liver failure and severe anemia that both of these conditions can be very debilitating and cause a lot of nausea and pain and discomfort. And also, we can't do a liver transplant in a horse. We can't solve non-regenerative anemia. We can do a blood transfusion and that helps for a little while. But in Cinder's case, there were not other options for improving her. We could maybe temporarily make her feel a little bit better with medications, but over time she would have continued to decline and feel worse and worse. So truly the kindest thing for her and the most appropriate course of action was to elect humane euthanasia and give her the last act of kindness. We were able to do a post-mortem examination on her. In humans, that's an autopsy. In animals, it's called a necropsy. So our vet team did a thorough necropsy on Cinder. Our goal with doing that is to learn not about that patient, but to learn more about future patients, because we get so many animals that come in with an unknown medical history that just don't function as we expect. And we did find that she had icterus throughout her entire body, which is just those yellow tissues. If you have a human baby that's jaundiced, that is also icterus. And if you have a human that's in liver failure, they also will start to have yellowing of the whites of their eyes. And many, many organs throughout Cinder's bodies showed evidence of icterus. Her liver was very small and fibrotic and abnormal. Her spleen was abnormal, so the spleen's job is to store red cells, among other things. So her spleen was very contracted and fibrotic, and she had some masses on her spleen. And then we also discovered that her reproductive tract was pretty abnormal. She had over 30 cysts on her ovaries. So ovarian cysts can cause chronic pain and discomfort, but they're very non-specific pains. We wouldn't necessarily expect to see like a colic. But in hindsight, this mare was trying to communicate with us all along that she had something major going on. It's really hard to let those animals go, but I'm really thankful that Cinder didn't end up going to slaughter and spending weeks or months going from auction to auction without someone listening to her, giving her the relief and medical care that she needed.